Welcome to the virtual tour of Cookeville Regional Medical Center's birthing unit. We are excited that you chose Cookeville Regional to deliver your baby and receive care. As any parent will tell you, while you can't predict everything about the day of your baby's birth, knowing where to go and what to expect from your hospital is a great first step to being prepared. We are excited to show you around our hospital and share what you can expect when it's time to deliver your baby. From pregnancy to parenting, the staff at Cookeville Regional's Birthing Center is here to support your unique journey as a family. At the conclusion of this video, we encourage you to visit crmchealth.org for more valuable information to help you prepare for your birth experience and to explore all of the resources available to you. That's crmchealth.org. To streamline the admitting process when it's time to deliver your baby, we ask that expectant mothers complete our hospital pre-admission process at least 1 month prior to their due date. You can call the registration department to provide your personal information. Registration can be reached at 931-783-2630. If you think you are in labor, the first step is to call your doctor or midwife. They will tell you if it is time to come to the hospital. You should also call your provider if your water breaks, if you have contractions that have been 5 minutes apart for over an hour, or for any other concerns. We offer 24-hour OB physician coverage, anesthesia services, certified nurse midwives, and pediatric coverage. When you arrive at the birthing center, please use the east entrance facing Cedar Avenue next to the emergency room. Now, we will begin the tour at the east entrance, where you will be greeted and quickly get settled into a room. When you arrive at the hospital to deliver your baby, you can pull up to the front door of the hospital and let the mom-to-be out of the car prior to parking. You will be able to park anywhere in the east entrance parking area in front of the hospital off Cedar Avenue. Be sure to adhere to all posted signage. The east entrance is open until 8 p.m. each evening, and the emergency room entrance is open 24 hours a day, 7 days a week. If you are arriving after 8 p.m., enter the hospital through the emergency room entrance. Our labor and delivery department is located in the east entrance of the hospital. When you get to the door of labor and delivery, there is an intercom system located on the right wall. Push the button and a staff member will answer and unlock the door for you. When you arrive at the labor and delivery unit, your nurse will evaluate your condition or concern, assess if you are in labor, how fast it is progressing, and discuss the situation with your provider. If you are in very early labor, we may send you home and ask that you return when you're further along. The decision is always made by your doctor or midwife. We understand the importance and encourage you to have a support person with you in labor and delivery. While we do our best to support the mother's wishes, our space is limited. Other visitors are normally allowed, provided that the environment remains safe, we have enough space to provide the needed care, and as long as visitors are truly supporting you and your birthing experience. However, we ask that you not bring visitors other than your support person until you know that you are going to stay. We also ask that you refrain from bringing children in while labor and delivery is underway. As your due date approaches, please visit crmchealth.org to check our most up-to-date visitor policy. Once the decision has been made that you will stay in the hospital and things are progressing normally, you can get up and walk in your room or in the hallway, sit in a rocking chair, or on a birthing ball, or even take a shower. All of our rooms feature private bathrooms, birthing beds, a warmer prepared for the delivery of your infant, and furniture for your support person. We also have a small amount of space to store a few belongings. We encourage our patients to utilize a variety of different labor support measures, such as birthing balls, music, and anything that will make you comfortable. Generally, upon admission, labs are obtained and an IV is started. You may discuss getting pain medication or an epidural or other desires for your labor and delivery experience with your labor and delivery nurse, your midwife, or your doctor. You can bring a camera to take photos and record before and after delivery. However, we ask that you refrain from recording during delivery. When your baby is born, your baby will be placed upon your abdomen or chest. We place babies skin to skin on your chest for you to see and hold. Putting your baby skin to skin will help your baby's vital signs and blood sugar stabilize, calm your baby, and help support breastfeeding. We routinely practice delayed cord clamping for 1 to 2 minutes unless otherwise recommended by the healthcare team. The umbilical cord will be clamped and cut, and your support person may help if they wish, and the medical staff determines that it is safe to do so. After your baby is born, a nurse will examine your baby and notify the pediatric hospitalist that your baby has arrived. A pediatric hospitalist is a pediatrician specifically trained to care for newborns, infants, and children in the hospital setting. An antibiotic ointment will be applied to your baby's eyes to help protect them from germs, and a vitamin K injection will be administered to support blood clotting. There is always a radiant warmer nearby and ready in the event that your baby needs additional support. If you're having a cesarean birth, also called a C-section, these are performed in special operating rooms located in the labor and delivery department. Your support person may attend the C-section, but no other visitors will be allowed in the operating or recovering rooms. In the rare case of an emergency C-section, your support person will not be allowed into the operating room. If you and your baby are well at the time of C-section and the obstetrician and anesthesiologist approve, your baby may be put skin to skin on your chest after delivery. After some time, a nurse will take your baby and support person to the recovery room. When you arrive in the recovery room, your baby may be placed on your chest again while you are recovering. You will be in the recovery room with your baby and support person for about 2 hours after the C-section. And then you and your baby will be transported to your postpartum room. If your baby needs extra attention or care after delivery, your baby may be taken to the nursery for additional medical attention. After the birth, you'll be taken to the postpartum suite similar to the one you see here. We encourage our patients to room in with their babies. This means your baby will stay in your room with you until you are both discharged. Keeping your baby with you will encourage bonding, supports breastfeeding, and enables you to become comfortable as new parents. Your bed is equipped with a call light and TV and lighting controls. Please use your call light to ask for assistance to the bathroom, for pain medication, or any other needs. Cookeville Regional encourages and supports exclusive breastfeeding. At the same time, we are committed to supporting each individual parent's feeding decisions for their baby. We have 3 internally board-certified lactation consultants on staff, but all staff are trained to provide assistance throughout your stay. Your baby will have 2 ID bands and 1 alarm band. You and your support person will each have an ID band that matches your baby's. The ID bands will all have the same last name, and it will be the last name that the mother is admitted under. The alarm band will set off the alarm if someone tries to remove the band, or if your baby is too close to a hospital exit. If any of the bands need to be adjusted, please let your nurse know. If anyone comes to your room to take your baby for any reason, please make sure they are wearing a hospital name tag with their photo and name. Only maternity staff wearing a unique hospital name tag and with specific identifiers on it should take your baby from your room. If we take your baby out of the room, your support person can come along with us. We will teach you more about this upon admission. If you walk in the hall with your baby, he or she must ride in the bassinet, not in your arms. CRMC provides hospital gowns, pads, and underwear for you to wear during your stay, but you are welcome to bring some of your own belongings as well. Diapers, wipes, and blankets are provided for your baby, but you will need to bring clothes and a blanket for your baby to go home in. Visit crmchealth.org for a full list of items you should bring. Please label any belongings you bring to the hospital with your name. Do not bring valuables to the hospital. You will need a car seat for your baby. The car seat should be new, and you should be sure that it has not been in an accident and it has not reached the expiration date listed on it. If you have questions about installation, please visit the link in the slide to find a child passenger safety technician near you. A great resource is safekids.org. There are many factors that impact your discharge time frame. If you have a vaginal delivery, you will go home 1 to 2 days after your baby is born. If you have a C-section, you will go home 2 to 3 days after your baby is born. Other factors include your infant's health and whether you are a first-time parent. We will escort the mother out of the hospital to ensure that she is able to safely walk to the car. Either the support person or a hospital employee will carry the infant in the car seat or push them in a bassinet to the hospital entrance. We know that bringing home a new baby is exciting, but can also be a challenging time for you and your family. We are here to help. Visit crmchealth.org for more information. Thank you for choosing Cookeville Regional Medical Center for the delivery and care of your baby. Giving birth is one of the most meaningful and memorable times you and your family will ever experience, and we are honored to be a part of your journey.